Hi everyone, I'm Stephanie Cowan from Chicago, Illinois. Today I'm going to be presenting on my poster examining the efficacy of JAK inhibitors in dermatomyositis. So first off, what is dermatomyositis? It's an idiopathic inflammatory myopathy associated with muscle weakness and a lot of systemic manifestations. So current immunological research suggests that the dysregulation of the interferon signaling pathway is implicated in the pathophysiology of dermatomyositis that I'm going to shorten to DM. Thus, blocking interferon signaling through inhibition of the JAK pathway via JAK inhibitors represents a potential therapeutic treatment for dermatomyositis. Thus, the aim of our study was to examine the efficacy of JAK inhibitors in DM-related inflammatory arthritis, skin disease, and myositis. How did we do this? This was a single-center retrospective case series conducted between May of 2002 to February of 2024. It was conducted at one academic medical center, and our population were patients with dermatomyositis treated with a JAK inhibitor for at least 6 months. For our inclusion criteria, we required that our patients be older than 18 years old, be diagnosed with DM by a rheumatologist or a dermatologist, and also treated with a JAK inhibitor for 6 months. So how did we do this? Ultimately, for all the patients who were seen in our clinic over the 22-year time frame, we filtered the EMR to look for patients who carried a diagnosis of dermatomyositis and also had a documented history of a JAK inhibitor in their medication list. Through that EMR review, we filtered 22 patients who identified both of those through the EMR review, and ultimately 10 patients met our inclusion criteria. Of those 10, 8 were treated with systemic tofacitinib, 1 was treated with topical tofacitinib, and 1 was treated with upadacitinib. So for our clinical outcomes, we found that 6 out of 6 patients treated for DM-related skin disease ultimately showed improvement in their skin disease based on our dermatologic assessment. 4 out of 5 patients treated for DM-related inflammatory arthritis showed improvement based on serial inflammatory markers. The one who didn't improve, unfortunately, was ultimately diagnosed with calcium pyrophosphate disease. Additionally, 0 out of 3 patients treated for DM-related myositis unfortunately didn't show any improvement, and that was determined because their CK levels did not improve. So in conclusion, our study showed that JAK inhibitors could be a potential treatment for dermatomyositis, especially in relapsing refractory skin disease and inflammatory arthritis. Unfortunately, our study did not show improvement of inflammatory myositis with JAK inhibitors, and this is a good area for further research. Thank you.